And with whatever system we have right now in place, no child or mother should be detained in hospital.
Senator Karen.
Thank you, Mr. Speaker. I want to make comments on the statement brought by Tharaka Nithi Senator Mwendwa Gataya. Mr. Speaker, this trend of holding newborn babies and new mothers in hospitals is a most unfortunate trend, Mr. Speaker. At any given time, any given day, Bagathi Hospital, Mama Lucy Hospital continues to hold dozens of women who have just given birth. And the main reason for this, Mr. Speaker, is non-registration on SHA, Mr. Speaker. I've heard Sifuna here wondering why, if SHA is working...
No, Senator Karen Nyamu, you shall refer your colleagues as honorable. You may proceed.
I'm guided, Mr. Speaker. I have heard the Senator for Nairobi, Honorable Senator Edwin Sifuna, wondering that if SHA still works, and if SHA is as real as we claim, why women are still being detained in hospitals after giving birth. The truth of the matter is, I have been to Mama Lucy myself. I have seen the women who have been detained due to lack of paying the bills, and all of them, 100%, they are not registered under SHA. And the reason why this is happening is because the SHA did not take into account the Linda Mama program that NHIF was taking care of. And the Committee of Health should demand a reinstatement of a fully funded insurance cover similar to Linda Mama that is fully funded under SHA, Mr. Speaker. Universal health care guarantees maternal health, Mr. Speaker. It is very important that we cover maternal health because these are eventualities of life that every woman faces, regardless of your financial status, Mr. Speaker. And also we want to demand that a review of the government, of the national budget is made to cover maternity health care so that women don't have to go out of pocket, Mr. Speaker. A lot of these women, and the urban poor especially, and in our slums, Mr. Speaker, cannot afford the 6,900 shillings that is the minimum premium for SHA, Mr. Speaker. I also suggest that on the first visit of pregnant women in any clinic, they are onboarded on SHA.
Senator Morgan.
Yes, thank you, Mr. Speaker. I rise to make a comment on the statement that has been brought by Senator Mwendwa Gataya. Mr. Speaker, it is really sad that over 50 years after this country attained independence, we are still debating a matter of children, newborn babies being detained in hospitals. Mr. Speaker, when we got independence, we were assured that we will ensure that our population will get quality health care, they will get access to water, education, etc. Mr. Speaker, this is a matter that should capture the attention of the government, Mr. Speaker. You know, babies are like angels. They are innocent, Mr. Speaker. So when you have a baby being born and then detained in hospital, we look like we are heartless, like we are a society that does not care at all, Mr. Speaker. Even if the mothers have not registered, there should be an arrangement where the government can write off bills. It's just welcoming a citizen, Mr. Speaker. We cannot have any justification whatsoever, Mr. Speaker, why we should detain newly born babies in hospitals. This is totally unacceptable. And Mr. Speaker, sir, if we are serious that we want to move from being a third world country to a first world country, These are the yardsticks that will be used to measure whether we are really migrating, moving towards being a first world country. How can you be a first world country, Mr. Speaker, when newborn babies are being detained in hospitals simply because their mothers cannot meet the medical expenses and the government cannot step in to pay for their medical bills? I want to appeal to the President because the buck stops with him. We need to put in place measures, Madam Speaker. At times it's good to own up. If Linda Mama was serving our mothers, why are we replacing it with something that is not working, Mr. Speaker? Let's own up in the best interest of our newborn babies. We reinstate Linda Mama, Mr. Speaker, so that our mothers can be welcomed to a country called Kenya without any pain or suffering. I support, Mr. Speaker.
Senator Mandago.
Thank you very much, Honorable Speaker. Honorable Speaker, allow me first to comment on the statement sought by Okia Mtata on maintenance of roads on sugar belts in this country, Honorable Speaker. Honorable Speaker, with the reinvention of sugar levy, we expect that farmers in those regions should not suffer transporting their produce to factories, transporting fertilizer to their farms, when levies are being collected for the same purpose, Honorable Speaker. Honorable Speaker, the only comment I want to make on this statement is that county governments should not overlap that responsibility by doing the same roads sugar levy funds are being applied to, Honorable Speaker. This is where funds are being lost by repetition of the work that has already been done, Honorable Speaker, and funds are lost. Honorable Speaker, I also want to comment on the statement by the Senator for Tharaka Nithi, Senator Mwenda Gataya, on the issue of mothers, Honorable Speaker. Honorable Speaker, I think this is a matter we really have to do a lot of sensitization. And our biggest and our weakest link in the rollout of UHC is actually county governments. Honorable Speaker, no mother, whether teenage or old enough, should be denied service or be detained in an hospital for failure to pay hospital bills. Honorable Speaker, our county governors, I really don't understand whether they are not reading the law that we passed in this house, or they have just abdicated their responsibility to people who have no capacity to deliver on it, Honorable Speaker. Honorable Speaker, all mothers who go to deliver in facilities, whether public or private, are supposed to be enrolled on SHIV. Honorable Speaker, SHIV does not require you to have an ID. A birth certificate is sufficient for you to be registered as a mother and to deliver in that facility, to even be carried out as cesarean delivery, to be treated, discharged, and the only thing that facility is supposed to do is to bill SHIV on the cost they have spent on delivering that matter, Honorable Speaker. Honorable Speaker, I get surprised when my colleagues want to take us to Linda Mama. You know, a lazy person would always want to remain in a comfortable place. What we must understand is that we cannot replace a comprehensive healthcare system by a sectional cover, Madam Speaker. Madam Speaker, if you are given an option to choose between a comprehensive insurance cover and a third party, Honorable Speaker,
I'll give you 1 minute because you are the chair of health to finish that statement.
Thank you very much, Madam Speaker. So I would want to ask my colleagues that for us to move, and when I hear people make reference to this is what we played in 1963, the reason we have never moved forward, we have never had a courageous president who would want to deliver a comprehensive health care like what we have today, Madam Speaker. Madam Speaker, county governments must do their bits. They must allow mothers to deliver free of charge. Let them bill SHIV. Parliament allocated 13 billion for SHIV. Why are they not utilizing those funds? It is just the usual laziness that they have used to it, and that is why even USC workers, they are unable to confirm, even when they have the money. We cannot keep blaming national government and the president. Governors must wake up, Honorable Speaker. And I'm wondering what is happening in this Senate. When I was a governor, we used to be harassed left, right, and center. There used to be a Sky team. What is happening these days is that it looks like Senate is not doing their work. I'm part of it, but pick and pack, the ones who are dealing with the funds for Shiva are not doing much. Pura kabisa. And Nairobi has the highest number of
Senator
senators who should
Madago.
go. I have not finished my 1 minute,
Senator
Madam Speaker.
Madago, your minute is gone, and once you choose to use English, use English. Senator Derito John Kenya, Laikipia.
As